Right now, your muscles are getting smaller, not because you are sedentary, not because you are not eating enough protein, because of a specific vitamin deficiency affecting over 73% of adults over 60 in the United States that directly disables the biological machinery responsible for building and maintaining muscle at a cellular level. Researchers at the University of Pittsburgh found adults over 65 with this deficiency lost muscle mass at a rate 3 times faster than those with adequate levels. 3 times faster, same age, same diet, same activity level, 3 times the muscle loss from one correctable deficiency, and the consequences extend far beyond how much you can lift. Research published in the British Medical Journal found that muscle mass in adults over 65 was a stronger independent predictor of all-cause mortality than smoking, blood pressure, and cholesterol combined. All 3 combined. Muscle is not an aesthetic concern. It is the organ your life expectancy depends on. Stay with me until the very end. I am going to name the vitamin, explain exactly why its absence destroys muscle at the cellular level, and go through the 10 most important things you need to know about muscle loss after 60 that no one is telling you. Number 1 on this list will change how you understand the word inevitable. Everything here is educational information only, not medical advice. Please work with your healthcare provider before changing supplement dosing, especially if you take medications that interact with fat-soluble vitamins. I am Dr. Edward, and I have spent over 15 years specialized in senior health, working exclusively with adults over 60. What I'm about to share goes against what many doctors will tell you, but I have seen it patient after patient, year after year, and I refuse to stay silent any longer. If you have noticed your strength declining and been told it is simply aging, subscribe to this channel right now, because the word simply is doing a lot of work in that sentence, and it is not accurate. Let me explain what is happening inside your muscles after 60, because the mechanism is precise and the solution flows directly from it. Your muscles are in a constant state of turnover. Old muscle protein is broken down, new protein is synthesized, and the balance between the two determines whether your muscles grow, maintain, or shrink. In young adults, the balance naturally favors maintenance. After 60, it shifts toward breakdown. That shift is driven by a process called anabolic resistance. Muscle cells become progressively less responsive to the signals that trigger protein synthesis. The same exercise load, the same protein intake, produces a blunted muscle-building response compared to a younger body. The signal arrives. The muscle does not fully respond. The primary regulator of the muscle-building signal is calcitriol, the active form of vitamin D. Vitamin D receptors are present in every single muscle cell in the human body. When calcitriol binds to these receptors, it directly upregulates the genes responsible for muscle protein synthesis, activates the satellite cells responsible for muscle repair and regeneration, and regulates calcium signaling within muscle fibers that controls contractile force. Vitamin D is not simply a supplement for bones. It is a hormonal regulator of muscle biology at the most fundamental level. When vitamin D is deficient, muscle protein synthesis is suppressed. Satellite cells, the stem cells of muscle tissue that repair microdamage from daily activity, remain dormant. Muscle fibers generate less force. Research published in the Journal of Clinical Endocrinology and Metabolism found that adults over 65 with vitamin D below 20 nanograms per milliliter had measurably lower muscle protein synthesis rates, lower satellite cell counts on biopsy, and significantly lower grip strength and walking speed compared to those above 30 nanograms per milliliter. And here is the number that should concern every adult over 60. The National Health and Nutrition Examination Survey found that 73% of adults over 65 in the United States have vitamin D levels below the threshold where muscle biology operates optimally. 73% walking around with vitamin D levels actively suppressing their muscle maintenance biology. Most of them have no idea because their doctors are not testing it or are testing it and using an outdated reference range that calls deficiency normal. Type in the comments right now. Have you ever had your vitamin D level tested? Yes or no? I read every single comment. 10 most important things to know about muscle loss after 60. Number 10. The condition most adults over 60 are experiencing has a clinical name, sarcopenia, the progressive loss of skeletal muscle mass and strength. It begins in the 40s and accelerates sharply after 60. Research published in the Journal of Bone and Mineral Research found adults over 65 lose between 1 and 2% of muscle mass per year on average, and between 1.5 and 3% of muscle strength per year. In a single decade, that is 10 to 20% of your remaining muscle lost silently, while you attribute every limitation entirely to age. Sarcopenia currently affects an estimated 10% of adults over 60 and up to 50% of adults over 80. The earlier intervention begins, the more muscle function is preserved. The time to act is not when you can no longer get up from the floor. The time to act is now. Number 9. Your doctor is almost certainly using an outdated vitamin D reference range that is causing them to tell you your levels are normal when they are not optimal for muscle biology. Most standard labs classify vitamin D sufficiency above 20 nanograms per milliliter. This threshold was established based on bone health data, the level needed to prevent rickets. It was never designed with muscle biology in mind. Research in the journal Nutrients found that levels of 40 to 60 nanograms per milliliter were consistently associated with superior muscle mass, strength, and physical performance in adults over 60. Not 20, not 30. 40 to 60. An adult with a result of 22 will be told their vitamin D is fine. Their muscle biology is operating well below optimal. The action: ask for your actual 25-hydroxy vitamin D number, not simply whether it falls within the normal box. Compare it to the 40 to 60 range that muscle health research supports. Number 8. Vitamin D supplementation without magnesium is significantly less effective, and most adults taking vitamin D are making this mistake. The conversion of vitamin D into its active muscle-regulating form, calcitriol, requires magnesium-dependent enzymes at 2 critical steps. Research in the American Journal of Clinical Nutrition found that vitamin D supplementation raised blood levels significantly less in magnesium-deficient adults compared to those with adequate magnesium. The vitamin D was consumed. Without magnesium, it was not being fully activated. Magnesium deficiency affects approximately 50% of adults over 65 already, which means roughly half of adults over 60 taking vitamin D supplements are getting significantly less muscle benefit than they should because the activation enzyme is running without its required cofactor, magnesium glycinate, at 300 milligrams before bed every night alongside vitamin D3. These two are a system, not optional additions to each other. Number 7. Protein intake after 60 needs to be significantly higher than standard guidelines recommend, and distribution across meals matters as much as total daily amount. Standard guidelines recommend 0.8 grams per kilogram of body weight per day, a target developed primarily using data from younger adults. Research in the American Journal of Clinical Nutrition found this is insufficient to overcome anabolic resistance in adults over 60. The research-supported target is 1.2 to 1.6 grams per kilogram daily. More importantly, anabolic resistance means a minimum threshold dose of 30 grams of high-quality protein per meal is required to adequately stimulate muscle protein synthesis. 6 small protein portions of 15 grams each across the day produces a significantly inferior muscle-building response compared to 3 meals each delivering 30 to 35 grams. The threshold matters. The distribution matters. Both. Number 6. Resistance exercise is the most potent stimulus for vitamin D receptor activation in muscle, and combining it with adequate vitamin D produces synergistic outcomes greater than either alone. Research in Osteoporosis International found that adults over 65 combining vitamin D3 supplementation with progressive resistance training had significantly greater improvements in muscle mass and strength compared to either alone, and resistance exercise for this purpose does not require a gym. Research from the Journal of Gerontology found that bodyweight exercises at home, including chair sit-to-stands, wall push-ups, and calf raises, produce significant muscle preservation in adults over 70 when performed 3 times per week. 3 times per week, 20 minutes, no equipment, no membership. Number 5. Sarcopenia drives fall risk specifically through the loss of type 2 muscle fibers. the fast-twitch fibers responsible for the explosive reaction that catches a stumble before it becomes a fall. Type 2 fibers are disproportionately dependent on vitamin D receptor signaling and are the first to atrophy when vitamin D is deficient. Research in the Journal of Clinical Endocrinology and Metabolism found that adults over 65 with vitamin D below 20 nanograms per milliliter had a 57% lower type 2 fiber cross-sectional area compared to those with adequate levels, 57% less, of the exact muscle fiber responsible for catching a stumble. Falls are the leading cause of injury death in adults over 65. And this is a correctable driver. Let me tell you about Susan. Susan was 68, a retired high school teacher from Boston, Massachusetts. Stairs that used to be effortless now required conscious effort. Rising from low chairs needed a hand on the armrest. She was cutting her walks shorter because her legs fatigued faster. Her last physical had come back normal for her age. That phrase again. Her vitamin D was 19 nanograms per milliliter. Her magnesium had never been tested. Her dietary protein was approximately 48 grams daily. 3 simultaneous deficits: vitamin D suppressing muscle protein synthesis, insufficient magnesium to activate the vitamin D she did produce, and protein well below the threshold required to overcome anabolic resistance at her age. We corrected all 3. Vitamin D3 at 4,000 IU with her largest meal. Magnesium glycinate 300 milligrams before bed. Protein restructured to 90 grams daily with 30 to 35 grams at lunch and dinner. Home-based resistance exercise 3 times per week. At 8 weeks, the stairs felt easier. At 3 months, she had returned to her longer walks. At 6 months, grip strength had increased by 18%. Vitamin D had reached 44 nanograms per milliliter. DEXA scans showed stabilization of muscle mass in her lower extremities. Her doctor called it a notable improvement for someone her age. Susan told me she did not love that phrase, but she loved the improvement. This was not a miracle. This was correcting 3 simultaneous deficits that had been systematically undermining her muscle maintenance biology, and the same correction is available to you. If this video is giving you a specific biological explanation for something you have been experiencing and attributing to age, please hit the like button right now. Type muscle in the comments as your commitment to beginning the protocol, and share this with one person who has mentioned feeling weaker and been told it is just getting older. Number 4. Common medications taken by adults over 60 directly impair vitamin D activation and absorption. Statins share the liver enzyme pathway used for vitamin D activation. Research found statin therapy significantly reduced calcitriol conversion efficiency in adults over 65. Proton pump inhibitors impair fat-soluble vitamin absorption by altering gastric pH. Corticosteroids reduce vitamin D receptor expression in muscle cells, partially uncoupling the muscle-building signal even when vitamin D levels appear adequate. If you take any of these medications, your effective vitamin D requirement is higher than standard supplementation guidelines suggest. Discuss this specifically with your doctor. Number 3. Sun exposure produces 75% less vitamin D in adults over 70 compared to younger adults due to changes in skin physiology, and dietary sources alone cannot close the gap. Research in the American Journal of Clinical Nutrition confirmed the 75% reduction from equivalent sunlight exposure. And even a diet high in fatty fish provides at most 1,200 to 1,800 IU daily, well below the 2,000 to 5,000 IU research consistently supports for muscle health outcomes in adults over 60. Supplementation is the only realistic path to adequate levels after 60, the specific form that matters. Vitamin D3, not D2. D3 is the form produced by the skin and is significantly more effective at raising blood levels and activating muscle receptors. Number 2. The Complete Muscle Preservation Protocol. Vitamin D3 at 2,000 to 4,000 IU daily with a meal containing fat every day. Magnesium glycinate at 300 milligrams before bed every night. Protein at a minimum 30 grams per main meal from leucine-rich sources: eggs, fish, chicken, Greek yogurt, legumes. Resistance exercise 3 times per week. 10 chair sit-to-stands, 10 wall push-ups, 15 calf raises at a kitchen counter for balance, 20 minutes, 3 times per week. And creatine monohydrate at 3 to 5 grams daily mixed into water or a protein shake. Research in Medicine and Science in Sports and Exercise found creatine in adults over 65 significantly increased muscle mass and strength gains from resistance exercise with no meaningful side effects at this dose. Creatine is inexpensive, safe, and dramatically underused in adults over 60. And number 1, the most important thing to understand about muscle loss after 60. Sarcopenia is not inevitable. It is not aging. It is a correctable deficit operating in a system that is still fully capable of responding. Research published in the Journal of the American Medical Directors Association found that adults over 70 who corrected vitamin D deficiency, met protein targets, and performed consistent resistance exercise maintained or increased muscle mass over a 3-year follow-up. Maintained or increased, not declined at average rates, at ages when the average is declining. The British Medical Journal finding I cited at the beginning of this video bears repeating. Muscle mass predicted all-cause mortality in adults over 65 more strongly than smoking, blood pressure, and cholesterol combined. The intervention your body most needs after 60, the one most directly connected to how long and how well you live, is not a complex medication. It is 4,000 IU of vitamin D3, magnesium glycinate, 30 grams of protein at lunch and dinner, and 10 chair sit-to-stands 3 times per week. You are not getting weaker because you are old. You are getting weaker because 3 correctable deficits are working together against the biology that maintains your muscle. And today, you know what all 3 are. Let me tell you about Charles. Charles was 74. A retired civil engineer from Dallas, Texas. He had fallen in his driveway 6 months earlier. Nothing broken, but he had been unable to catch himself on a slight uneven crack in the pavement. He walked every day. He was careful about his diet. He could not understand why his legs had not caught him. His doctor referred him to a balance clinic. Vestibular function, normal. Reaction time, average for his age. Conclusion, falls happen, be more careful. Charles was not satisfied. He came to me asking for a physiological reason. His vitamin D was 17 nanograms per milliliter. His grip strength was in the lowest quartile for his age. A 5-time sit-to-stand test placed him in the high fall risk category. He had normal reaction time, but insufficient rapid explosive leg strength to translate that reaction into a catch before the stumble completed. The vestibular system was fine. The type 2 muscle fibers needed to use it were not. Vitamin D3 at 5,000 IU given his critically low baseline. Magnesium glycinate, protein restructured to 100 grams daily. A progressive lower body resistance program emphasizing explosive sit-to-stands targeting the type 2 fibers most critical for fall recovery. At 3 months, his sit-to-stand time had moved from the high-risk to the low-risk category. At 6 months, grip strength had reached the average for his age group. Vitamin D level, 52 nanograms per milliliter. He has not fallen since. He told me that is not the metric he uses to measure the protocol. The metric he uses is that when he walks now, he does not think about whether his legs will catch him. He used to think about it with every step. This was not a miracle. This was restoring the type 2 muscle fiber function that vitamin D receptor signaling maintains and that his deficient levels had been silently eroding for years. That restoration is available to you, your complete protocol, starting today. Step 1. Vitamin D3 at 2,000 to 4,000 IU with your largest meal, with food containing fat every day. Ask your doctor for a 25-hydroxy vitamin D level. Get the actual number. Target 40 to 60 nanograms per milliliter. Step 2. Magnesium glycinate at 300 milligrams before bed every night. Step 3. Minimum 30 grams of protein at lunch and dinner from eggs, fish, chicken, Greek yogurt, or legumes. Step 4. Resistance exercise 3 times per week, 10 chair sit-to-stands, 10 wall push-ups, 15 calf raises, 20 minutes. Step 5. Creatine monohydrate at 3 to 5 grams daily. Timeline: 2 to 4 weeks, improved energy and early strength gains. 6 to 8 weeks, measurable grip strength and functional improvements. 3 to 6 months, vitamin D in the optimal range, and measurable muscle mass stabilization. 5 mistakes that undermine this protocol. Mistake 1. Taking vitamin D2 instead of D3. D2 is less effective at raising blood levels and activating muscle receptors. If your doctor prescribed D2, ask specifically about D3. Mistake 2. Taking D3 without fat and without magnesium. Fat-soluble absorption requires dietary fat. Without magnesium, the activation enzyme cannot complete the conversion to calcitriol. All three together, every time. Mistake 3. Spreading protein in small amounts throughout the day. 6 servings of 15 grams does not stimulate muscle protein synthesis in adults over 60 the way 3 servings of 30 grams does. The threshold dose matters, always. Mistake 4. Relying on aerobic exercise alone. Walking is excellent for cardiovascular health and should continue. It does not upregulate vitamin D receptors in muscle or activate satellite cells. Resistance exercise must be added alongside it, not instead of it. Mistake 5. Concluding that intervention at 70 or 80 is too late. Research consistently shows muscle protein synthesis responds to vitamin D correction, adequate protein, and resistance exercise in adults in their 80s and 90s. The biology does not stop working. You are not broken. Your muscle maintenance biology was being starved of the inputs it needed. Today, you know what they are. 10 points. 10. Sarcopenia begins in the 40s and accelerates after 60, with 1 to 2% muscle mass loss per year on average. Begin now. 9. 73% of adults over 60 are below optimal vitamin D for muscle biology. Target 40 to 60 nanograms per milliliter, not 20. 8. Magnesium glycinate, 300 milligrams, is the required activation cofactor for vitamin D. They work as a system. 7. 1.2 to 1.6 grams of protein per kilogram daily, minimum 30 grams per meal to overcome anabolic resistance. 6. Resistance exercise upregulates vitamin D receptors 3 times per week, no equipment, synergistic with adequate vitamin D. 5. Type 2 fiber loss drives fall risk, and vitamin D deficiency reduces type 2 fiber area by 57%. 4. Statins, PPIs, and corticosteroids impair vitamin D activation. Higher doses may be needed if you take these. 3. Sun produces 75% less vitamin D after 70. Supplementation is not optional. 2. The complete protocol. D3 with fat magnesium glycinate, 30 plus grams protein per meal. Resistance exercise, creatine monohydrate. Number 1. Sarcopenia is not inevitable. Adults who correct the deficits maintain and increase muscle mass at ages when the average is declining. The biology works. It simply needs the inputs. Commit to just 3 changes. Starting today, get vitamin D3 and begin with dinner tonight. Add magnesium glycinate before bed tonight, and do 10 chair sit-to-stands right now before you do anything else after this video ends. Just those 3. Tonight, your muscles have carried you through every step and every staircase of your life. They are still capable of rebuilding, still capable of responding, still capable of being stronger 6 months from now than they are today. They have been running without the vitamin that regulates their maintenance biology, the mineral that activates that vitamin, and the protein threshold they need to respond. You are not getting weaker because aging is inevitable. You are getting weaker because 3 correctable deficits have been working against the most important organ system your longevity depends on. And today, you know what they are. And today, you can begin correcting them. Subscribe to this channel. I publish specific, actionable information for adults over 60 every single week. Ring the notification bell. Type in the comments whether you have had your vitamin D tested and what your number was. Share this with one person in your life who has been told their weakness is just getting older. Aging does not take away your body's ability to recover. It simply reminds you to care for it the right way. Take care of yourself.